Um, I'm going to go ahead and share my screen here. Hopefully y'all are seeing that. Let me get into the right mode. Everyone seeing that okay? All right. We are going to talk about a cheery topic today, advanced care planning. It's actually something near and dear to my heart. As I have mentioned before, I am an internal medicine doc by training. I also did a fellowship in hospice and palliative medicine and practiced in that area for a number of years before doing more work in preventive medicine and public health and returning to Neomed. So I'm going to go back a little bit to my roots and talk about advanced care planning with you guys this afternoon. I'll start out with who should be considering advanced care planning and when. And my simple answer is anyone and everyone. As we all know and have probably unfortunately had personal or professional experience with, serious illnesses, accidents can occur at any age and they can occur without any warning. So it's really important to be having these conversations with all of our patients as well as with our loved ones for our own personal reasons. Ideally, we want to have these conversations before somebody is in a crisis situation. It's obviously much easier to talk about sort of hypothetical scenarios, what people's wishes are, and certainly to complete paperwork when folks are not in the middle of an acute crisis. In Ohio, there are two types of advanced care planning documents, and we're going to talk through each of these one by one. They are the living will and the healthcare power of attorney. So we'll start with the living will. A living will documents the type of care that a patient would want to receive if they were terminally ill and unable to communicate or permanently unconscious. And that has to be certified by two different physicians. So if a patient is able to communicate their wishes, we don't pay attention to their living will. And I think this is sometimes a misconception that folks have. They're afraid that if they put something in a living will, then they're not going to be listened to anymore. That's not the case. If you're able to communicate your wishes in the moment take precedence. The living will only goes into effect if you're no longer able to do that. It allows the patient to indicate their preferences regarding comfort measures at the end of life. And it also allows them, if they so choose, to avoid artificial measures to postpone death if they are in the states that I already mentioned. Some living wills or some people choose to include in their living will special instructions, for example, authorizing withholding artificial nutrition or hydration in those circumstances. Not everyone includes those instructions. Living wills can be revoked by the patient at any time. So if a patient fills out a living will and then changes their mind or changes their mind about part of what's in it, it can be changed, it can be revoked. It's not meant to be a static document. We'll talk about that a little bit more later. People do not need attorneys to prepare this document. So you can find this document online. I've actually included some links in the references to help you all find them. It does need to be signed and dated in the presence of either two witnesses or a notary public, but you don't need to have an attorney do this for you. It should be shared broadly. So it should be shared with the healthcare team. It should be shared with close friends and relatives because we can't honor people's wishes if we don't know about them. And we're going to talk in a moment about healthcare power of attorneys, but living wills supersede healthcare power of attorney in the event that the patient is terminally ill or unable to communicate or permanently unconscious. So whoever is appointed as a healthcare power of attorney cannot override what is documented in a living will. So, turning to healthcare power of attorneys, the healthcare power of attorney allows a patient to name a person as well as alternates who can make healthcare decisions for them if they are unable to. So, a healthcare power of attorney can take effect anytime a patient is not able to express their own wishes. So, it's not limited like the living will is to a situation where a patient is terminally ill and not able to communicate or permanently unconscious. So, for example, if you are having surgery and you are under anesthesia and the doctor needs to talk to somebody to make a decision about what to proceed with in the OR, they may speak with your healthcare power of attorney, whereas a living will really wouldn't apply in that situation. Within the healthcare power of attorney document, a person can choose to nominate a guardian and alternates. They don't have to, and we'll talk about what this line of succession for decision making is in Ohio if you don't have a guardian appointed in a moment. And healthcare power of attorneys are different from, they're completely separate from financial powers of attorney. Sometimes patients will get confused and think if they have a healthcare power of attorney, then they also have a financial power of attorney or vice versa. They are two separate things. You may choose to appoint the same individual as your healthcare power of attorney and your financial power of attorney, but you do not have to. There are some limitations on the authority of what somebody who is appointed as a healthcare power of attorney can do. They can only decline life-sustaining treatment if the patient is terminally ill or permanently unconscious, and this has been confirmed by an attending physician, and it's been determined that the patient does not have a reasonable chance of recovering their own decision-making capacity. Healthcare power of attorneys cannot refuse comfort measures for patients. There are some limitations that are in place if patients are pregnant, and they may only decline nutrition and hydration if the patient is terminally ill, permanently unconscious, and the physicians agree that these measures are not providing comfort. If a patient has previously given consent for a specific treatment, the healthcare power of attorney may not stop that treatment unless the patient's condition has changed and the treatment is no longer considered beneficial or effective. Like the living will, a healthcare power of attorney can be revoked at any time by the patient. Also, like the living will, you don't need an attorney to prepare the document, and again, can be signed and dated in the presence of 2 witnesses or a notary public. And as I already mentioned, should be shared with the healthcare team, with close friends and relatives. People often ask, should they have a living will or a healthcare power of attorney? And the answer is generally both. As I already mentioned, they can apply in different situations, and so it's kind of important to cover your bases. If there is no healthcare power of attorney, it's important to recognize who would be the decision maker for a patient who's unable to speak for themselves. And this varies by state. So it's important to know, each state where you practice, it's important to know their law. But in Ohio, if there is a guardian, that person would become the decision maker if there is no healthcare power of attorney. If there is no guardian, then it goes to the patient's spouse. If there's no spouse, then you'd be looking to adult children. If there's neither a spouse or adult children, then it's the patient's parents. If that person does not exist or is not available, it goes to adult siblings. And if none of those people exist or are available, it goes to the nearest adult relative or nearest adult who is related by blood or adoption. And I included the information about Ohio Revised Code where you can find that line of succession outlined. DNR orders. So DNR orders are separate from the other advanced care planning documents that we talked about. So they are not part of the living will. They are not part of the healthcare power of attorney document. Although it's important for your healthcare power of attorney to understand what your wishes would be related to DNR orders, certainly. DNR orders are written by a physician, a nurse practitioner, or a physician assistant. There are 2 different types of DNR orders in Ohio. There's DNR comfort care, and that protocol goes into effect right when the order is issued. And there's also DNR comfort care arrest. And DNR comfort care arrest only becomes relevant if a patient is in cardiac or respiratory arrest. There's nothing different that happens in a patient's care up until that point is reached if a patient has a DNR comfort care arrest order. Again, like living wills, like healthcare power of attorneys, DNR orders can be revoked at any time. A lot of times we hear a lot about what healthcare providers won't do if somebody has a DNR. And I think it's important for people to understand what they will do. And again, this is if a patient has DNR comfort care or if a patient has a cardiac or respiratory arrest and has DNR CCA in place. So providers will still assess the patient. They will still perform basic medical care. They will still clear the airway if there's an obstruction or provide suction if that is going to help open up the airways. If it is going to provide comfort or help with distress, they can give oxygen, they can apply CPAP or BiPAP. They may obtain IV access if there are measures that are going to help with the patient's comfort. So in other words, if they feel that hydration or pain medications would be beneficial for the patient's comfort, they may obtain IV access to do that, but they're not going to administer medications through that IV that would prolong the dying process. And they can also contact other healthcare providers. What they won't do is perform CPR, give resuscitative medications to restart the heart or breathing, insert airways, defibrillate or cardiovert the patient, or initiate continuous cardiac monitoring. Just some final thoughts around advanced care planning. I think it's really important that we normalize these conversations. They're difficult conversations. Nobody wants to have them. Nobody wants to think about the possibility of these things occurring to themselves or to their loved ones. But I think it's important that we make sure it's part of our usual care for patients. I often would start conversations with patients and families again when they are relatively healthy and say, this is something that I talk about with all of my patients because it's helpful for me to understand your wishes in case we get into a situation. it's better to prepare for the worst and hope for the best. So I think we should be normalizing these conversations. I think we should also be having these conversations, as I've already mentioned early, and often. So anytime there's a change in a patient's medical condition, we should be bringing this topic up for discussion. And even if there's not a change in the patient's medical condition, we should be having these discussions every few years, because people's perspectives change as they go throughout the life course. And it's important to know what they're thinking, and how we can best meet those wishes. Um, Patients should, and I already alluded to this, patients should speak to whoever they appoint as their healthcare power of attorney and alternates regularly so that they are up to date on their medical situation and their wishes, because really the job of the healthcare power of attorney is to make sure that they are carrying out the wishes of the patient when the patient is unable to speak for themselves. If the patient does not have a POA, they should at least be encouraged to discuss those wishes with family and friends, because as you saw in that line of succession, some of those people might be called on to make decisions in lieu of a POA if there is none. I included a link here that has a lot of really good explanations, sort of written in a comprehensive but also understandable way. It also has the paperwork that's actually embedded in it, so it's a really nice resource to give to patients. It's also really helpful for yourselves or your families if these are things that you're working on. With that, I'm open to any questions, and there is, as I mentioned, a resource page with some other links that might be useful for all of you.